Okay. So I prepared this kind of thinking that your parents and sisters and brothers and friends and coworkers might be here. So I'm still going to kind of pitch it that way because we are recording this, and I'm hoping that then we can share it with people who are just kind of, there's a gap between here's my experience and here's what my whole family thinks that I'm experiencing. But it will be better if you give input as we go along. So please feel free to do that. What I really come to think about people in the cancer world as I've worked with them now about 8 years is that almost all things are a continuum, and families fall on somewhere along the line. So there's some families who the cancer world becomes their world. So everything about their life is all about cancer. The whole family knows all the names of the drugs. They're at every CCC event. They're at every walk. They're doing every single thing. And there are other ones who won't even say the word cancer in their home. And won't even tell the child that that's what they have. I've had clients from both sides. So I've had clients where they're just so sick to death of coming to the CCC because every time the doors are open, again, so many times that's the siblings. And then there are other ones who the first time they come, they're like, oh, somebody really understands me, because they haven't been doing anything in the cancer world. I think you guys said it took you a while to find the CCC, right?
We didn't even know about
somebody probably told us about it, but it was like
I said, with what we were already going through when she was diagnosed, it was basically just autopilot at that point.
December.
Until December, when her social worker at the hospital was like,
they referred you.
Christmas thing.
Yeah.
I'm like, and you felt weird about that because it's so we did it, and that's how we got to know Sharon and everything. So I mean, it was like a year after she was diagnosed. So.
Yeah. And sometimes it's just survival mode, and so it's just hospital and home, and there is no outside stuff. So I think people fall along the line, and the problem that I see with extended family members is they assume that you should be at one particular place on the line, and you're not. And so, if they think you ought to be way over here, but you find yourself way over here, then there's a conflict. And so the ways they can help you would be to accept where they are. So, think about the adult cancer world. Pink ribbons, right? Breast cancer ribbons. In October, there's, seriously, they're going to be all everywhere. But there are some women who were like, do not bring that into my home. I don't want one. I don't want a pink shirt. If you wear pink, get out of here. It's the same thing. And what if, you guys, the gold ribbons this month, right? So what if you have a teenager who, this would be for you, not the extended family, they're like, I don't want anyone to know. I'm going to wear my wig. It's a new school year. They're not going to know it's a wig. I'm just going to go to school. I'm not going to tell anybody. You better not tell my teachers. And then you or the grandparents are like, no, let's, wear the ribbons on our shirt and let's put bumper stickers on our car. There's just built-in conflict there. So what can, the way that your family can support you is know where they are, but also accept that you don't have to be in the same place they are. And that's okay. It can happen between husbands and wives. It can happen between siblings. It happens a lot between grandparents and parents. And oftentimes, and that's one thing we talked about when we decided to have this, was most of the time, your extended family members are trying to be loving, most of the time. But they oftentimes are the opposite. They really mean well many times, but then they do things that just really hurt. And so it's important that they accept where they are, they accept where you are, and then if there's a difference, be kind about that. That you can give them a break by realizing they're trying, and they can give you a break by realizing you're the ones who are in it, and they're not. They get to go home during steroid week, and you guys don't. That is that's what you're living. So as we go through this, we'll kind of talk about, over here on the extreme, over there on the extreme. When Becky was talking, I was thinking about discipline, because I've seen a lot of times where the parents are trying to discipline the kids, and the grandparents are like, she's going through cancer. Don't make her do X, Y, Z. Don't make her bed. Don't make her go to school. Don't make her, fill in the blank. But the problem with that is, from where I sit, is that subtly communicates to the child, I don't think you're going to make it. Because if I thought you were going to make it, I'd be treating you just like I would any other kid who's going to live to be 95. But if I don't think you're going to live, then I'll be like, who cares? You make your bed, you pick up your toys, whatever. So it sounds kind of counterintuitive, and grandparents are the worst, right? Because they're the worst anyway. When parents try to set rules regardless, when there's no cancer, the grandparents are like, don't tell your mom. And they're giving them Coke, or they're doing whatever. That's just grandparents.
The drink, not the drug.
You guys keep things interesting.
I don't know you. Could be from Miami. I don't know.
So, see, throw me off every time.
Sorry.
That's quite all right. That's quite all right. Those things are hard, and it's awkward, right? Because if you're talking to your mom or dad, whatever baggage you already had from growing up in your home, you already had that, right? It didn't go away just because you got a cancer diagnosis with your kid. And so whatever is tense there usually gets more tense as cancer shows up, because no one knows how they're going to react to a cancer diagnosis. You can't predict that, because none of you thought you'd be in this room right now. And your parents, their grandparents didn't think that either. I'm being tough on the grandparents because I find that there's the most conflict. But I also have known where you really thought this one sister or brother or friend, they were going to be the ones who would be there. And then it's like crickets, and they're not, and they don't come. And then there are people that you would never have dreamed. I know we've talked about this before. They're the ones who step up and they mow the lawn and they do all those things, because nobody knows how they're going to act when they get into it. So I'm going to go through these do's and don'ts, and I would love for you to chime in on things you agree or disagree with. These are things that I've kind of collected from you guys and from the families who came before you over the last several years about ways they can at least do no harm, right? And maybe they can help. So one thing they can do is to learn the language. So to be honest with you, I don't understand everything you guys say about counts and particular drugs. But I know enough that I can talk to you and I can say things to the teenagers to let them know I know a little bit of the rules. It's like if you went to another country and you at least took the trouble to learn some of the language. Usually that goes a long way.
The basics of it.
The basics, yeah. So it goes a long way to saying, okay, I'm trying. I'm not trying to be someone who just assumes that everything ought to revolve around me. Versus the opposite, which is, tell me again about what happens when you go to the hospital, or what chemo is, what do you have steroids? Isn't that exhausting? And you have to tell the same story over and over again. So they can either learn a language or just stop asking.
Or they can at least just say cancer. Like,
they can
that's
say the word
another thing that I've found too, is that nobody even likes to say the word cancer, regardless of what kind of cancer you have. Just say it. It's just a word.
Yeah. People are very scared.
They already have it. You have it.
It's not getting worse.
Yeah.
Just say it. People always say, "Oh, you're sick." No, I have cancer. It's not like I have a cold. I don't have the flu. I have cancer.
Yeah.
My daughter has cancer. Just say the word.
Yeah.
It's not a bad word.
It's not that which shall not be named.
For many other people, for me, cancer is like devastating. It's not like easy thing.
It is devastating, and I agree with you.
It's not just like happy is a word,
No.
but means happiness. Cancer is a word, but means sickness.
It does.
So that is different.
It is different. It is different for everybody. I'm not taking away from that. It's just for
everybody takes a different.
Yep, and like
for me, I just by listening to the words, like.
Yeah. No, I'm with you, and I'm not taking away from that either.
Yeah.
But I know for me personally, it was hard. Like, especially after I was diagnosed and my daughter was diagnosed, it felt like people were distancing.
Well, that's I think that's her biggest point is people didn't want to say cancer and they didn't want to come around.
Yeah.
Because they're like, ooh, don't touch me, I don't want to get it.
Right.
If I don't say the word, I won't get it myself.
Right.
Yeah,
and it's not that it's not hard word to say.
Cancer, like you say, it doesn't matter. It could be
leukemia. Yep.
Any type of cancer, but that word is just.
It is a terrible word. I agree with you.
Devastated word.
Yeah.
But when you're living it too, it is.
It's just like when the doctor said it. It's like you don't process it right away.
No, not at all. I agree with you. You don't process it, but that is for you. But when somebody disassociates you, somebody who should be helping you or somebody who should be in your life, who disassociates themselves from that word altogether, it is kind of like, I don't have the flu.
Because a lot of people make it out of that.
Yep,
and
they
a lot
do.
of people don't.
Yep, I agree.
Yeah, there's a lot of fear. So
there is a lot of
they're living out of fear instead of living out of love.
Yep, and they disassociate themselves from the word, and then they disassociate themselves from you.
Yeah.
And that's the
Many
hardest
times.
part. It's like that word has so much attached to it that as a person who's living in it, you're like, just say it, please, because then it's real. Not that you want it to be real, but it's real, and I'm a real person. My child is a real person.
Not invisible.
And we can.
You can still
connect.
come over and
You
hang
can
out.
still come over.
That's
You
right,
can
that's
treat
okay,
me like a regular person, even though we're dealing with what we're dealing with. But yeah, I found that people can't even say the word cancer. Again, regardless of what kind of cancer you have.
Because like you say, you come over and stuff like that, but no, there is a lot of people like, for example, when the cancer is so low, you cannot bring people over because whatever they bring from the outside, it can affect the patient.
And it's a very isolating thing.
Exactly.
I agree. It is a very isolating thing.
It's a huge change.
Yeah.
I agree.
It turns your world upside down. Yeah. Yeah.
But it is nice for people to acknowledge that.
Mhm.
At least for me. It is different for everybody, but at least for me it was. And then when my daughter got it, it was very nice to say, just say it. I made more people uncomfortable making jokes about it than people who had nothing to do with it. Like people who don't even have any. They don't have a family member. They aren't going through it. They would be just like. I'm like, please.
That doesn't help.
It doesn't help.
It doesn't help.
It doesn't help at all. Like you're just making it worse. You're making me feel more isolated. You're making we're already isolated. Like you said, low counts. You're isolated with a small child. That even an older child, when you have low counts, you spend weeks at home, isolated by yourself with that child, and. This coming from you.
I'm going to take the notes.
Really?
Try to bring us back on subject.
No feelings. Right.
So,
continue. Sorry.
something to do is to offer to help only if they actually mean they're going to help. Because a key thing that I hear is very irritating over and over is to say, if you need anything, just call me. Well, the energy that it takes to think about what I need and then call and see if you'll come and do it, I don't have that energy if I'm dealing with my kid or the well sibling or whatever. And so just come over and mow the yard. Just come over and do the laundry. But here's the don't. Don't assume that you know what help they need the most. So maybe they come over and they want to do the laundry, but that's not what you need. You need the dishes done. Or maybe you need right now just the 4 of you or just the 3 of you. They need to be able to hear, I'm so glad that you want to help, but now is not the best time. Circle back around, come back on Thursday, come back on a different day. That doesn't mean you don't like them. It doesn't mean you don't want their help. It just means it's unpredictable. You can't know how.
It's not a good moment.
It's not a good moment. Right. And if it's really about the child, or if it's really about you because you're their child, then even though that may be uncomfortable, then they can back off and come back later. So your parents or your siblings or your coworkers, something they can do for you and that I want to do for you is say, you're doing a good job. Because a lot of times the focus, just like the siblings, the focus can be all on your children, and you're having to make sometimes impossible choices. Doctor comes in and says, well, here's the deal. We've got to start this treatment right away, but we might want to harvest the eggs because they might not be able to have children later. Okay? You didn't wake up thinking that you're going to have to make that decision for your child that she won't even need to know about until years down the road. And you're doing the best you can. I've met lots and lots of cancer families, and almost all of them are doing the best they can. It would be good if they told you that, just to say, you're doing a great job. But I've learned it's not helpful for them to say, you're so strong. I don't know how you do it.
I didn't know I had a choice.
Exactly.
Because if I had a choice, I'd be like, where's my boat to Maui?
And that's a response that I hear over and over from parents is, it's my kid. What am I going to do? Just leave my kid? No, I'm not. I'm just going to do whatever the next thing is to do. So I hope they listen to this, or you can send them to this on whoever's website it's on and just say, don't say that. It doesn't help. They probably mean well, because they're probably trying to do the best they can too, but it doesn't help, so they can just stop doing that. Do talk about normal things. I know you've talked about this before. It's all right to talk about the bucks. It's all right to talk about the weather. It doesn't mean that they're shallow or unsympathetic. Sometimes I think you guys would like to talk about something besides cancer or chemo or counter radiation or transplant or whatever. And I think there's a lot of fear of, if I talk about how I got caught in traffic today, that's just going to seem so superficial, when really it could be a very welcome break from whatever.
It is. When somebody is telling you about their day, Kimberly's my sister. Kimberly used to do this all the time. She would talk about her day and how crappy it was, but then always have the caveat, oh, I shouldn't complain to you because you have cancer, so is your daughter, and you have a crappier day than me. It's like, don't say that. I would love to listen to you talk and bitch about your day.
Yeah, what that does is push you away when people do that. Oh, I know you have it so much worse.
Right.
That doesn't draw you closer. That pushes you away.
Very
Yeah. And then staying away because they don't know what to say is a very common thing. It would be better, I think, to say something stupid and then apologize for it than to just stay away and be gone out of your life for a year or two. And think about, your children are little. Yours is
almost 14.
Okay, so middle school, right? High school. 3, a little one. Okay. If you're a grandparent or an aunt or uncle and you choose to step back because it's just too hard, you're missing your grandchild and you're missing your niece or your nephew during really important times of their lives. And let's not flip that around and say teenage years are not important either, because there's all kinds of studies that say teenagers will listen to their grandparents when they won't listen to their parents. Yeah. So the grandparents are important. They're important to come in. I know sometimes that can be a plus or minus.
If they want to be involved too, if
not.
Okay, this one kind of goes back to the first one. So learn about the cancer world, but don't offer, I heard if you take this supplement, your child will be well. Really, you should not be, that chemo is going to kill them. Again, if they're trying to support you, they're on the wrong track there.
So are you telling me lavender oil is not going to cure cancer?
I'm telling you that.
Frozen lemon.
Frankincense. My sister-in-law gave me frankincense because I had colon cancer. My sister-in-law was like, if you rub this frankincense
on your belly,
on your stomach,
it'll go away.
Your colon cancer is gonna go away. I'm like, okay.
Yeah.
Let me do that.
Somebody told me, oh, in Mexico have a good treatment.
Yeah.
This fruit is going to be...
Exactly.
Yes.
So I asked the doctor about it, and they say, there's going to be a lot of people telling you, this is going to cure this. For cancer, it's cells.
Yeah.
Okay? We don't know if this type of fruit is for this type of cancer or for that type of cancer. they say cancer, but they don't say what type of cancer.
Right?
So it can help. Maybe it can help. Or maybe for certain cells that are cancers.
Yeah.
But maybe this part
Because
it won't work.
and that's the thing. As parents sitting at these tables, like, if there was an alternative medicine that would actually cure our children of the cancer that they have,
You would already have done
really think we'd be
Not
pumping
like 2.5 years worth of treatment.
Exactly.
Right.
Do you really think that we would be subjecting our children to chemotherapy or radiation
Right.
or a number of surgeries that may or may not work?
Mhm.
No.
Oh my god!
Of course I'll rub lavender. I'll rub lavender oil in my kid's eye every day, and they'll be cured. Like, of course, and
Yeah.
I've got.
Yeah.
I don't know if anybody. Yeah, we've gotten that a lot
Straight.
too.
I just
And as a
want
medical
straight
professional,
like,
it is
talk
so
to
hard for me
somebody
to bite
and
my tongue and
Exactly.
press.
like when she was bald, they'd all
I just wanna be like, you're
"Oh my
stupid."
gosh, I know this way. There's a way.
Yeah.
So hard.
There's a doctor.
I imagine.
Exactly. Like,
But sometimes on the most, how you say, vulnerable
Vulnerable.
vulnerable.
times, we take everything sometimes.
Oh, we do.
I think
Yeah, it is.
Clean
Yeah, it's
diet,
desperation,
you
it's
didn't
fear
eat fast
that's
food.
driving that.
Exactly.
It's not like they're mean and evil people.
No.
They just are misguided and they're missing
the
you.
best piece of advice that her oncologist said, or like the one thing he said that made the most sense, was it's like no matter what they say or what they ask and blah blah blah, they have no idea what they're talking about. What they're really saying is, "I love you."
Yeah.
But I don't know what I'm talking.
I don't know what to do.
Yeah.
Yeah.
Well, they would ask.
Dr. Wolf was the best.
Yeah, they'd
My
ask.
oncologist was the
And so I
best.
took him for his word. So when people would ask, "Hey, what stage cancer does your wife have?" I would read off the entire stage. I'd be like, "Oh, she has 3 Tango 2 Papa 3 Alpha 12K,"
Which is exactly.
and like the whole diagnosis. And they'd be like, "Oh, I'm like, yeah, you don't know
And
what
then
that
it
is,
is
dude."
great.
And the
Ways.
thing is,
Yeah,
the
me
minute
neither.
they heard stage 3, like half of them just burst into tears because they thought I was dying. They
Yeah.
thought I was just on death's door.
And
like,
it's like you have no
I'm like
idea.
this close away from
But-
just like.
And that's how I always think of it. It's like, hey, I get it. You're just saying you love us,
Right.
And you're supportive, but quit coming over with your frozen lemons. I got a whole
Yeah.
freezer full of
Please.
lemons.
Papaya's not going to work.
I mean, mango
Yeah.
at least goes into other mixed stuff. I can use mangoes.
Coconut oil rubbed on various
Yeah.
areas of the body.
Not so much.
Combined with tea
Good
tree
for
oil
itching,
is
yeah, you-
not going to help.
Yeah.
Yeah. Yeah, so the way you guys can support, it's not your job to, but the way you guys can support your family is to translate it as love.
Yeah.
And the way they can do it is really pay attention and stop saying those things that communicate to you, oh, I think you're doing the wrong thing. Because that's really, maybe they don't mean that, but that's the message that's coming through. You're doing the wrong thing for your child. What's the worst possible thing to say to a parent who has a sick kid? Okay. For them, now this one's important. They need to take care of themselves because they're the parents. And it is never until, if they're sick or they're so elderly they can't take care of themselves, it's never the child's job to take care of the parents. It wasn't true when you were little. It's not true of you now. They need to take care of themselves. They can get a therapist. We'll be happy to see them. They can have a support group of friends because, of course, it hurts to have a grandchild who has cancer. Of course it does. But it's not your job to take care of the grandparents and the aunts and the uncles and everybody else who feels so bad because you're busy taking care of your kid. And you're probably not doing a good job taking care of yourself. If you're like any other parents that I've met around here, that's hard. And so it's their job to take care of themselves. And then the don't depend on you. When you find yourself, and this happens all the time, you're having to comfort the people who are coming, like you said, they burst into tears, and you're the cancer patient, or your child has cancer, and you're the one who's comforting the people. It happens all the time, but it's really not appropriate. That's just not. I don't like shoulds, but that should not be.
They're the same ones that say, I don't know how you do it.
Right. Right.
You're so strong.
Yeah.
Yes.
So strong. Yeah. So do pay attention to the dad. Dads often get left out in this world, and it's kind of a stereotype.
The fact that you get paid attention to way more
You don't have feelings. Why do you need to be paid attention to that?
See, there you go.
You don't care anyway.
That's a good yes.
I have feelings. They're just deep down inside.
Right, then keep shoving.
I let anger out because that's a really fun one to let out.
Or not. Or it's one
Just
that
saying,
causes
I'm up on the
problems.
board.
So very often, not always, but very often, the dad, if there's going to be someone who steps out of work, very often the wife will step out of work, the mom will step out of work, and the dad will continue to work because you got to have insurance, right? And so the dad is still suffering.
Totally.
Totally suffering. I know about the tears.
Sorry. I'm sorry.
So they need to be paid attention to too, but it's easy to ignore them because men typically won't say that they are hurting. They won't let on anything besides anger or humor or all of those things. I'm going to confiscate your notes. Would you like me to read that to the class?
It's not written yet.
And the problem is, don't assume anyone's emotional state. Because sometimes, we have kind of, especially in American culture, we have these stereotypes of here's what women probably feel, here's what men probably feel. But we're humans and we don't all fit into a neat mold. And so they can help by supporting the one who's not going to the hospital every single day, if that's the way it rolls out. Okay. It is good to encourage a positive outlook. There's all kinds of research studies that positive outlooks lead to better cancer treatment outcomes. However, it's not good to insist on sunshine and unicorns all the time. So if a kid or you needs to be mad, it's okay for them to say, I hate this. I don't want to be poked today. Oh, no. The doctors are just trying to help you. That doesn't help because it's dishonest. The kid, you were kids, you could spot a lying adult from 10 miles away, and they can too. And so it's good for a grandparent, and again, I'm picking on the grandparents, but they're the worst. No, it's going to be all right. It's all fine. But it's not all fine. People don't go to, if it was all fine, then other people would be doing it just for fun, right?
Right.
No one's going to the hospital to get a port. Just for kicks. It's not what happens. And so it's good to be balanced. It's good to tell the truth, even while remaining positive. How are we doing on time?
It's 8.
It's 8 right now. Okay, I'll go really fast. This part.
Not only all the time.
All right. So we're going to finish up. Something that your families can do to support you who are going through this is to respect new boundaries. And you've mentioned it, and the word counts comes up a whole lot. So no, if you have a cold, you should not go over to that house. And it's not a small thing. Like if someone comes to my house, I don't have someone with cancer living in my house. It's not a huge deal. My son might get the cold, I might get the cold. That's annoying, but it's not a life or death issue. But if the counts are low, it really is a life or death issue. And it's disrespectful to the nth degree to walk into someone's house when you're sniffling or whatever. And people are clueless about that. They don't really understand. And so I put don't minimize the safety when the hair grows back, because I keep hearing this. Well, their hair goes back, so their hair is back, so they must be fine. I'll just come over when I have snot running down my nose, I'm doing this or whatever. But the hair doesn't always fall out to begin with. And then when it's back, that doesn't mean the treatment is over. It doesn't mean that the counts are recovered, the immune system's recovered. So it's not appropriate. And they can be supportive by simply respecting the boundary. Don't come. Or accepting, we're not coming to Thanksgiving. Counts are too low. None of us are coming. So a lot of times family members will get offended by that. We want to all be together as a family. Well, of course, that's what we would want too, but not if it's going to kill our child.
Or take precautions. Wear
a mask. Mm-hmm.
But a lot of them are like, we're weird. Okay.
Yeah.
You're not allowed around them.
Yeah, exactly. That's the choice that they're making. Do give lots of time and space, including after treatment. Dr. Becky was talking about how the fact that we see families very often who treatment is over and then the emotional symptoms appear. because they've been in survival mode, they've been containing the emotions, and then all of a sudden they don't have to. And siblings are notorious for this, that they'll hold it together and hold it together for their family, and then the child gets well, and then the sibling's life blows up. And so then very often we're getting them after that. So your family can support you by realizing when you ring the bell, if that's what your hospital does, or you have the ceremony over here at the CCC, that doesn't mean it's over. It just means that part's over, and then another part's going to continue. Like you've had a relapse recently, so you understand, and they may not understand.
And side effects, could it be weeks, days, maybe months, maybe
years?
It can be like long time term side effects.
In terms of the clients I've seen from the cancer center, I think the longest one has been 11 years from diagnosis. So I was seeing a young adult who had a diagnosis when he was under 10. And that was, things had come up that didn't come up when he was 9, but they did come up when he was 20. So I had to deal with those. The people who are supportive, they can educate the rest of the family about it because they're the ones who are trying to learn the world, and they can act as a buffer sometimes so that you are not having to always tell the story over and over again. Somebody's not happy out there. But we don't want them to speak for you because that's not appropriate. You speak for you, they can speak for them. It's kind of a middle ground of explaining about counts, for example, or explaining about, well, they're not going to come to this family reunion because it's just not safe, or I'm going to go stay with them for a while and do some of the practical stuff because they're always at the hospital, or whatever that is. So it's kind of in the middle. And then I've heard people say at the cancer center a lot of times that people that would normally babysit for them refuse to babysit once there is a cancer diagnosis. Like, oh no, I'm afraid I'm going to break the child, I'm going to kill the child.
Or what if something happens then?
What if something happens? But really, most parents wouldn't go out if there was a great danger of something drastic happening. And they need a break. You guys need a break. You need to talk about not cancer. And so they can come over and babysit, even if it's just the well sibling. The well sibling needs a break from you, right? They need some time without you being stressed out around them. They need some time to relax and play. And then I put on there, don't criticize a spouse. Be very normal for like your mom to criticize however your spouse is handling how everything's going. But the best thing that you can do for your kids is take care of you and your marriage so that they have that solid, stable thing to fall back on. And so criticize, I can't believe he did that. I can't believe she said that. I can't believe he's not XYZ. That's not helpful to the child. And I think it's easy to lose sight of that and think it's not about the child, it's about the husband or it's about the wife. But really that affects the child because then that undermines the family. So they can support the child by supporting the whole family. Okay? All right. So we want to say that if we can help you, we'd like to do that. I know you who are here have heard that before, but people who are listening, hopefully on this kind of like a webinar, we would love to help. You can call Sharon at the center, depending on your relationship to the child, or you can call us directly if going through the center is not something that will work. You can call us. Also, this is a new thing that we're proud of. We can now offer telehealth, so we can offer counseling sessions not when you are in our office. So if you're stuck in the hospital but you really need a session, if you can find a private place for yourself, we can do it through the phone or through the screen. It's not the best. The best is face-to-face, but it's better than nothing. And so we would love to have it. Some people, they travel up to Philly, or they travel to Houston or wherever. But that doesn't have to mean you get it. People say all the time, I don't want to start over and tell the whole thing to a new person. So now we can support that through our practice. Any questions?